Welcome to Common Sense. The Common Sense show is a series of shows featuring interviews with interesting people so that we can learn in a clear, concise, and direct way who these folks are, what they do, and what brings them to this part of Ohio, and what makes sense to them and what doesn't. I'm Rudy Breglia, and today I'll be interviewing the astute and knowledgeable hearing expert, doctor of audiology, Jessica Ryder.
Thank you for having me.
Okay, Jessica, welcome to Common Sense.
Thank you.
Please start us off by telling us where you were born, where you live, and what brings you to this part of Ohio.
Yeah, so I was born in the Cleveland area.
Oh, okay, a native.
Yep. Always lived in Ohio. Grew up in Brunswick and Columbia Station.
Okay.
Still staying in
That's real
Columbia
country,
Station.
yeah, right?
Yeah, it is. Yes. I still in Columbia with my family, so I have a husband and 2 boys.
Well, how nice.
Yes. Oldest one's 11 and a half, and youngest is 8 months, so.
8 months,
Big
oh my
range.
God, you've
Yeah.
got plenty of
Yeah.
interesting things on hand.
For sure. Yep.
Well, to start us off with the very basic, what is audiology?
Yeah, so audiology is the study of hearing and balance. Along with that, an audiologist is the person who also studies hearing and balance and specializes in that as well.
Okay. What inspired you to become an audiologist? Did you have a role model?
Yeah, so a good way to put this is I've always wanted to be an audiologist since I was young. Or let me backtrack. Always wanted to be in the medical field ever since I was young.
Understand.
When I started to go to school, I was going to take nursing courses, which I did start. And then I found that I just would really prefer to do something more specialized. So in my case, I've had a hearing loss ever since childhood. I have normal hearing on one side and a unilateral hearing on the hearing loss on the other side. So I've worn a hearing aid ever since I was probably about 5 years old. So that's what sparked my interest, and I'm glad I'm doing it because I could really relate to my patients.
That's wonderful.
Yeah.
What's the role of an audiologist at AudioNova, where you work?
We specialize in hearing, so we provide comprehensive hearing health care. So we test hearing, we diagnose and treat hearing loss with hearing aids, and then we provide ongoing education for our patients as well.
Understand. What is the required training, education to become an audiologist?
So you have to have an undergrad in speech and hearing, as well as a doctor of audiology, which is typically a 4-year graduate program. So altogether, in my schooling, I went to school for 8 years.
Wow.
Yeah.
Wow. How do we normally hear and have balance in for all of us?
Yeah, so hearing is a complex process. So I'll kind of try to break that down a bit to make it a bit more simple. But there are 3 main sections of hearing. There's the outer ear, middle ear, and inner ear.
And I think our viewers will see a slide of that.
They will, yep. So with that slide, you'll see that there is the outer ear, which has the ear canal, which then goes into the middle ear with the 3 middle ear bones in the eardrum. And then with the inner ear, you have that snail-shaped organ there, which is the cochlea.
Okay.
And then we also have those 3 semicircular canals at the top, and that's for our balance. So the way hearing works is the vibrations from the sound is traveling through the ear canal and then hits the eardrum. From there, the vibrations from the eardrum are transmitted through the 3 middle ear bones. The middle ear bones then travel that vibration through the cochlea, which is the inner ear. In the cochlea, there are hair cells and also fluid inside as well. So the waves are traveling through that fluid. It is picked up by the hair cells, and then the hair cells then transmit that signal to an electrical signal sent up the auditory nerve into the brain. And then our brain is then what processes that sound. So it's kind of the simplified version, but
that's how it all works.
Yes, for sure.
With the smallest bones in the body, I understand.
Yep. So the stapes is the smallest bone in the human body. Yep, and that's housed within the inner ear or the middle ear. Yep. Yep.
Okay. What generally causes balance issues?
So the way we maintain our balance is with three main systems. It's our vestibular system, which again is in the inner ear, our visual input, which is from vision, and then our somatosensory input as well, which is our muscles and our joints and our awareness of our body. So if any one of those three systems are not functioning properly, then we tend to have balance issues.
Understand.
Yep.
What's the general cause of hearing loss in seniors?
Yeah, so age-related hearing loss can be common. We call that presbycusis. So it's a slow, gradual decline over time, typically bilateral, so equal on both sides. And then with that being said, speech understanding is declined as well. So people who have this age-related hearing loss may notice that going in noisy environments and groups of people, they really have a hard time understanding speech as well. There are actual physical properties in the ear that change too as we age. So just like everything else as we age, those hair cells in the ear, they tend to, die off and don't work as efficiently for transmitting sound.
Okay.
Yeah.
Can the sense of balance be impaired when hearing loss occurs?
It can. So we use our ears to localize sound and for spatial awareness. So when we don't have that hearing or we have that reduced hearing input, then yes, yep, we can, then our balance is affected.
Okay, it flops over.
Yeah, for sure.
Okay. And to be a little specific on a hearing problem, what is tinnitus? Do I pronounce that right?
Some people call it tinnitus, some people call it tinnitus. Either way, both ways are correct.
Okay, understand.
But what that is a sensation that person hears that no one else can hear. So it's not an external sound, it's only coming from within, the ears. That can sound like ringing, buzzing, clicking, crickets, all different kinds of sounds to yourself. That can be caused from several different things. One, hearing loss. 2, different medications someone's on. 3, trauma in the ear. So over years of trauma, such as noise damage over years, that can then lead to tinnitus as well.
How do you manage that?
Yeah, so
I would think that would drive you crazy.
I know. Yeah, there are some people who have that who really do. How do we want to say, suffer from that for sure.
Okay.
And then there's some people who they hear it, but they are just used to it. It doesn't bother them at this point. But the way you can manage it is, one, there could be medications that your doctor may put you on to help, subside that ringing, buzzing that you get. Therapy is another way to do it. So, calming techniques, things like that to work on, and that could help that tinnitus that you have. And then lastly, sound therapy too. So hearing aids, that could help, fill in the gaps where we're missing our hearing, and then provide external sound in the ear so that it tends to distract you from that tinnitus you get.
Okay, that's wonderful. What are some signs that suggest someone should get a hearing test?
So if you are noticing you're having to ask other people to repeat often, or if other people are noticing that you have, trouble hearing or misunderstanding them, that's a good sign that you need to get your hearing tested. Other things such as, the TV being loud, radio loud, a lot of times when I see couples in for appointments, the other person will then report that. So.
Okay.
Yep.
What can you expect during a hearing evaluation at AudioNova, and I think we're going to see the results of a hearing evaluation on the screen.
Yes. So with a hearing test, you would come in and we start off with case history, which we go over your history and everything like that. Then we jump into otoscopy, which is where we look in the ear and make sure there's no redness, wax, buildup, anything like that. And then we jump into the hearing test. With the hearing test, you'll hear a series of beeps where we ask you to click on the button whenever you hear the beep. And that is at different pitches and different sound levels. With that, we are trying to detect the very softest sound a person can hear. We also provide the speech testing as well. So we'll ask you to repeat back words at an elevated level, either in a quiet environment and or with background noise included. After that hearing test is completed, we then may do something we call tympanometry, which is a middle ear screening. So that will then let us know how your middle ear status is. And when I say that, that's more of like your eardrum, making sure there's no hole in the eardrum or pressure buildup, fluid behind the ear, anything like that. Now, with the audiogram, you would see on the screen, there is a blue line with the X's, which indicates the hearing for the left ear, and then the red line with the circles, which is for the right ear. What we are looking for when we look at a hearing test is to make sure that both of the ears are similar in configuration.
Okay.
And then anything at the 20 mark there and below is considered some type of hearing loss.
Okay.
So on this screen, you'll see that this person has a mild sloping to severe hearing loss. And then in that case, we would recommend hearing aids for this person, for sure.
Okay. About how long does that, the whole testing take?
The testing is maybe about like 10 to 20 minutes.
Okay.
Depending on the kind of hearing loss someone has. And then we typically book the appointment for about an hour, so then we could go over the results and possibly do a consult and everything afterwards.
Okay. Are free hearing tests available?
So we do offer complimentary hearing testing on AudioNova.
Wonderful.
We also offer demonstration appointments as well. So we do what we call better hearing events about once a month. In those events, we provide the testing and then we can demonstrate the hearing aids in office while you're there as well.
Wonderful,
Yeah.
wonderful. What's the best way for removing earwax that can interfere with hearing? And you mentioned it before.
So the best way we can first do that is professionally. So to go to an ear, nose, and throat doctor, your audiologist, or sometimes even your primary care will offer flushing of the ears. Now, methods at home is using over-the-counter wax softening drops and then flushing your ear with warm water as well. What we want to avoid is not to try to flush your ears at home if you've ever had ear surgeries, hole in the eardrums, anything like that. And we do want to shy away from Q-tips as well. That could also cause damage.
Yeah.
Yeah.
That's the thing. You don't stick anything in your ear bigger than your elbow.
Yeah, smaller than the elbow. Yep. Yep.
Oh, okay. I said larger than the elbow. Okay. All right. How can untreated hearing loss affect communication and relationships?
Yeah, so with hearing loss, we tend to misunderstand things often, and that can cause frustration on both sides. So asking people to repeat several times can be embarrassing for one. So then sometimes people just will avoid situations because of that, because they know they can't hear. So social engagements, groups, family settings, things like that, they can't engage anymore, or they're really straining to be able to hear. So that really can put a strain on relationships.
Yeah.
Yeah.
Could see where that could happen.
For sure.
All right. Is there a connection between untreated hearing loss and cognitive decline?
So there are studies out that show all of the different, challenges that could have with cognitive function as well. So when we have hearing loss that's not treated, there's less room for attention, focus, and memory. So you're using the effortful listening to have a conversation throughout the day. By the end of the day, we're more fatigued, and then you don't have the extra energy to really remember what you're supposed to do at the end of the day, or focus and have a conversation. So
okay.
yeah.
What other health conditions are connected to hearing loss? And I think the viewers will see a slide on this whole issue.
Correct. So you'll see on the slide there's several different things that are connected to hearing health. So for instance, there is a higher risk of falls involved, a risk of the Alzheimer's and dementia, depression as well. So again, that connects back to that social engagement with other people. If you're shying away from situations like that, then you could become more depressed. Other things such as diabetes as well, that can increase your risk for hearing loss too.
Okay, understand. How has hearing amplification evolved over the years?
So this started all the way back in the 1600s with those ear trumpets. So have you seen those?
I've seen those on the old movies.
Yes, yeah. So it started out with the ear trumpets. That was their kind of amplification back in the day. And then it evolved to more of body hearing aids, where, it was like this big square amplifier that would go in someone's pocket and then wired up to the ears. And then later on in the years in the 1950s, that's when analog hearing aids came out. And then in 1996, that's when digital hearing aids were released. And then later on in the 2010s, that's when Bluetooth became available with hearing aids. And then now what we have is hearing aids that can have artificial intelligence and even dual processing chips. So it's really cool. They really made a long evolution there. Yeah.
Okay. Can you share the available types of hearing technology offered today? And I think the viewers will see a slide of it.
Yes. So there are different kind of hearing amplification. There's what we most think of as hearing aids, which there's different types like over-the-counter versus prescriptive hearing aids. And then there's even cochlear implants, which is some more, severe hearing losses. And then what we even call bone-anchored hearing aids, which is a piece that is actually like typically surgically put into, a post is put behind the ear, and that vibrates the skull, and you can hear it that way.
Okay.
Now, what we offer at AudioNova is 3 main styles of hearing aids. And what that is a receiver in the canal hearing aid, which is a piece that goes over the ear, wire in the front, and then rubber dome on the inside. The second style down is behind the ear hearing aid, which is, again, a piece that goes behind the ear, and then it has a tubing that connects that from the hearing aid to the outer ear to an ear mold that's molded to the ear. That's for a more significant hearing loss or with someone who has recurring like ear drainage and ear infections. That last one on the list is that in the ear kind of hearing aid, which is typically custom made for the patient. So we would take
small.
Yeah, it can be small or a little bit bigger. It depends on what we're looking for. Like if we want the Bluetooth or battery operated or things like that, that's how we can tell. Yep.
Do prescriptive hearing aids provide benefits more than just an increase in loudness or amplification?
Mm-hmm. So prescriptive hearing aids help to clarify speech and also reduce down background noise. So it's not only turning everything up or down, it is really giving the patient really what they need based off of their hearing loss specifically.
Okay. Mm-hmm. Are hearing aids necessary in both ears?
Depends on the person.
Okay.
If we have hearing loss in both ears, more than likely we would need hearing aids in both ears. There's some cases where someone may only have a hearing loss on one side and then would only need one hearing aid.
But that's probably the exception.
Yeah, it's not typical for that to happen.
Okay.
Yeah.
What are some common misconceptions about hearing aids?
Mm-hmm. So sometimes people think that hearing aids will restore hearing back to normal, which is not the case necessarily. Hearing aids can only aid the hearing that we have left. So for instance, with someone with a really significant hearing loss and really poor speech understanding, hearing aids can only do so much for them, for instance. Another thing is people think that hearing aids are only for older people, which again, not always the case. Even with me, I've had a hearing aid ever since childhood.
Okay.
So it could come at any age. It's not only for older people as well. Yeah.
Okay. Could a delay in using corrective hearing aids produce irreversible hearing damage?
It's possible. So we don't want to say there's going to be physical damage in the ear if we delay that, but it's more the benefit you would get from a hearing aid when it's time to wear it. So if we wait years and years, after detecting that we have that hearing loss, then your speech understanding will likely decrease as well.
Okay.
So then the time when you're ready to wear them and you really need them, it's going to be harder to really adapt, and you're not going to be able to hear as well.
Okay.
Yeah.
So there's a brain kind of a thing, understanding speech.
Yeah. I typically say too, hearing aids are like a therapy for the brain. Yeah.
Good. That's good.
Yeah.
Can single loud noises at fireworks displays or concerts damage hearing, or is the damage cumulative with repeated noise exposures?
It could be a mix of both. So in some situations, if the sound is very, very loud, and when we say like over 120 decibels, for instance, that can cause immediate harm to the ears. And then, that repeated exposure over time, that could also cause that harm to the ears over years. Now, in situations where we go to a fireworks show with the family and everything like that, typically we are at a far distance from that sound source. So at that wouldn't really give us enough input to then damage the ears like that.
Okay.
Now, we do recommend to wear hearing protection, if you are going to be closer to that sound source, or if you are going to be really around really loud sounds for a duration of time. So a way we can protect our ears is with foam earplugs, for instance, muffs over the ears, or even custom hearing protection as well.
Okay.
Yep.
Can noise damage be reversed?
So, not really. So there's two kinds of things that we look at. There could be a temporary threshold shift, which is when someone can experience tinnitus or muffling of speech after an incident, exposure to the noise, that typically will resolve after hours or days. Now, a permanent threshold shift, it will then shift your hearing. So you might experience that muffling or that tinnitus that does not go away, and it's there. Yeah.
So it's important to protect your ears.
For sure, we have to protect what we have.
So you're on your way to a concert, you might want to put in some of those foam.
For sure. Yes.
Okay. What makes AudioNova different?
Yeah. So AudioNova, again, we provide comprehensive healthcare, and our biggest thing is being able to follow up with patients and keep them on our schedule. So whenever someone were to leave, with a new set of hearing aids or for a follow-up appointment, they always know when they're going to be coming back, because we're always going to schedule them before they leave. That is the biggest downside for most places is, they'll see patients, maybe fit them with hearing aids, and then don't get them back for follow-up care.
Yeah, adios.
Yeah, but no, it's really important for the follow-up care.
Okay.
Yeah.
What's the AudioNova website?
Yeah, so you could go to audionova.com.
Okay. That'll appear on the bottom of the screen in post-production.
Yep.
What is your email, phone, and address? All those details.
Yep. So my personal email is jessica.ryder@audionova.com. And then our phone number, we'll see that on the screen there. And then if you want to reach out for an appointment, the best way to do that is to call our phone number, or you could email me directly as well if we need.
Okay, and the address?
Oh, good question. 805 Columbia Road, Suite 106, and that's in Westlake, Ohio.
Okay.
Yep.
Well, a question I ask every interviewee, what makes sense to you and what doesn't?
Yeah, so what doesn't make sense to me is people typically treat their vision and have their vision checked yearly, but people don't take that seriously with hearing. We should protect our hearing. We should protect our vision.
Just as important.
Yeah. Our senses are really precious. Once that sense is gone, you really can't get it back. It's not like your natural vision or not like your natural hearing, So I would definitely say if someone's having an issue hearing, to get your hearing tested, or even come in just to get a baseline, see where you're at.
Okay.
And then if we don't find you have a hearing loss, a few years down the line, if you start to notice a decline, then we can compare, which is really important. So,
okay, that's very wise.
Yeah.
Well, thank you very much for appearing.
Yeah.
I think this will be very helpful to viewers who have a bit of a hearing loss. I'm in that category, so I really appreciate your answers.
Yeah.
And thank you for watching. If you have any questions or comments, please send them to the emails that will be appearing at the bottom of the screen. If you know someone who's interesting or you would like to appear on the show, please send us your contact information. And remember, seatbelts save lives.